sometimes in the beginning you cannot charge that month for the patient, your patient cannot pay you there. But if you don't invest the extra time there, you're never going to go up in the staircase for high level treatments.
Welcome to another episode of the 3 on 6 podcast with Dr. Randy Roberts.
Education, empowerment, starting now.
Welcome to the 3 on 6 podcast. We're here with world-renowned Dr. Ricardo Kern, who's been gracious enough to join us. He's been here with us for the summit, the 3 on 6 summit, where he's been helping train all of our doctors in advanced tissue grafting techniques. I got to see him for the first time in October at the PICO Symposium, and you really stood out to me as, somebody who can help take my skills to another level. And I was really impressed with all of your work, and so I thought it'd be amazing to meet you, have you out here with us, and help train all of the 3 on 6 doctors to help them get better results. And your training was absolutely amazing and astounded me, and I was felt like it was definitely worth getting you out here for this journey, and so grateful for you for coming.
Thank you so much for the invitation. It's a huge pleasure, and it's even more nicer to know that we can help still people to incorporate new techniques for the daily based practice. So that is the idea of being a speaker, is really to be able to share some important things that can complement the work. So really glad to know about that.
So thank you so very much. So I think on this podcast we have some people who are patients who want to learn more about the 3 on 6, and we also have doctors who are interested in learning. So just for the doctors or for patients, if you just want to tell us, what was your journey like to become from when you graduated school and to get to where you are right now? What has your journey been like?
Okay, it's a long journey because now I'm 25 years that I'm the dentist, and I think what make me to do my job now in the positions and that I'm having now is, first thing, I focus on perio, right? I'm a periodontist, but I never drop aside the full understanding of dentistry. So since the beginning, I was doing the full treatment of my patients, from the planning, the provisional, the surgery, the final deliver. So for that, I need to understand almost everything, a full panorama for the treatment of the patient. And that full picture view make me understand better what I could do by the surgical point of view to improve both. I don't think I had develop or work with the techniques that we are doing now without a lot of understanding from the prosto part, design, provisioning, rehabilitation of the patient. So I think that helped me more than everything to still maintain the global vision, the total treatment of my patient.
Yeah, I feel like that's been very advantageous for you, right? But I feel like it's been a little bit a bit of a disadvantage to the industry because we've separated the different specialties. We've got the oral surgeons that are bone grafting and placing the implants and doing the surgeries. And then we've got the prosthodontists who are placing the teeth, and we've got the periodontists who are doing the tissue. And there's sometimes a little bit of a disconnect between each one of those. So unless you're doing all three of those, like a lot of the things that I've incorporated that I've learned from you into our surgeries are how you have to design the prosthetic in order to be able to have good tissue. And a lot of times when patients are referred back to you, it's because their tissue is thin, but if the prosthodontist or the person putting the teeth in had shaped the teeth correctly and the abutment correctly, then the tissue would have developed correctly. So you have to get into those other roles in order to be able to help them do their job.
Yes, and interesting point that you brought was from sometimes the financial point of view, if you focus and just do one single process, one single procedure over and over, you're going to be faster, you're going to be more productive, probably going to have more money in your office, on the clinic. But if you want to really go for the next level, you're going to invest part of your time trying to understand, of course, other specialties, right? Your case is going to be more slow because you're going to incorporate more things, but I consider that like an investment. So I can expend more time, make less money in the beginning, but I'm going to understand and I'm going to improve much more. For now, I'm able to, how can I say, get the profit for what I invest in the past. Do different procedures that sometimes other people cannot manage exactly because of that. So this is the point of view of not just focusing on one single specialty, but sometimes when you are beginning work with some techniques and you are thinking about the financial point of view, sometimes I think you cannot just think about the money because you're going to take more time to do a case and deliver this case for the aesthetic point of view that you want to get there. And sometimes in the beginning you cannot charge that month for the patient, your patient cannot pay you there. But if you don't invest the extra time there, you're never going to go up in the staircase for high level treatment. So I think it's an investment.
Right. Yeah, and that's definitely something that I learned in my practice was treating every case is like, I don't know, like you're a lesson and you're learning. Mm-hmm. So each patient, what can I do to give them the best outcome, whether or not they're able to afford that? Like the very first 3-on-6 patient was my cousin, and he couldn't really afford implants or anything like that. And so my goal was, what can I do to help out my cousin, because he doesn't have he has to pull out all of his teeth because of meth mouth. And so what would I want to do for my cousin, or for myself, or for my sibling, or for my mom if I had to pull their teeth out? And so at first, just from what I had learned from school, was you put in 4 implants and then you do like a denture, like a snappy denture or an all-in-4 type prosthetic. And so I did that in his mouth, and he said, I won't have that in my mouth. I can't have a denture in my mouth. And so he was just happy to go without teeth. And I said, what can I do for him? And so at that point, I'd learned how to make 4-unit Emax bridges with the CEREC. And so I just put in a couple more implants, and I did 3 4-unit bridges in his mouth. And he said, I'm alive again. Like I can smile, I can talk, I can eat, and it helped get him out of his depression, and it helped him feel like a human again. And I didn't make any money, but I learned a ton. And that was the very first case of this. And then 6 months later, another person was in a similar situation. A friend of my brother said, you know what, I've got this guy that he can't really afford anything, but is there something you can do to help them out? And I'm like, again, it's a learning process for me. I'm not really making any money on it, but I am, trying to figure out how to do full mouth implants. And I did another 3-on-6 on him, and he again loved it. And so after doing that several times after a while, then it became, maybe I should give this a name, because it seems like there's a lot of people who don't want this. People would come into my office and they'd get a treatment plan for like $50,000, $60,000 for an all-on-4, which is what the price of it was back then. The prices have come down a lot for an all-on-4 since then. And I said, well, I did this thing on my cousin and on another guy one time. And so yeah, anyways, trying to just treat people like people and trying to figure out.
And it's a great name indeed.
Thank you.
Yeah, it's really, really nice. Yeah, it's very good.
Yeah, I was trying to think what's something that kind of like it's a kind of a competitor to all-on-4 or all-on-X. I'm like 3 bridges on 6 implants. They're talking about different numbers, but it kind of sounds similar. So thank you.
No, it's good. I think split the treatment for the bridges over 6 implants has some benefits. Mm-hmm. Came from my school in philosophy in Brazil, to treat in a full arch. And we know the pros and cons of both, but it's really nice to see, how can I say, this different approach. We mentioned something about a little bit more tension in the bone and more maintenance in the bone. Can you speak a little more about that?
Yeah. So So Wolff's Law says that the more stress that you put on a bone, the more the bone density will develop around that bone.
Okay, good.
So it's just like if you break your arm, you'll put your arm in a cast for a while. But if you leave your arm in a cast forever, then your bone density will start to go down and will start to dissolve away. But if after a few months you take your arm out of that cast, you can start putting a little bit more stress on it, a little bit more stress, and your bone will get stronger and stronger.
Yep.
And so I take that same philosophy into the mouth. If you split in the full arch, at first it makes sense because that helps protect all the implants and helps protect them from failure. But if you leave them splinted forever, then they're not going to be able to get that stress that they need to continue to develop the bone around them.
Mm-hmm. Actually, they say when you break a bone and that calcify, once again, probably if you break the arm again, it's not going to be in the same spot.
It's even stronger.
Spot
there.
is stronger, yes.
Right.
Yeah.
Yeah.
Same thing, exactly. Very good. Nice.
Thank you. So a lot of the things that you're teaching, like I've never seen anywhere before. And I was talking to you about that just a minute ago, and I was asking you, did you learn these techniques, or how much of it was learned versus how much of it was developed? And from what I understand, you're kind of taking little bits and pieces from things that you learned, but you're creating a lot of it yourself. Like, what's that process like? How do you create like this, all these things that you've been able to create to be able to make the tissue?
Great. I think every new innovation it's impossible for come out from the blue, from zero. Someone is starting something from zero. That happens, but is rare. Usually the development that you have came from previous work. So people in environment, in a culture, and understand a little bit about a few things being done, and then you give the next step. Someone using your knowledge to also help that and to increase even more. The technique that we're working nowadays basically was a combination of the traditional periodontology and the need that you have to incorporate that for the actual implant dentistry, right? The amount of tissue necessary over an implant to stabilize the peri-implant tissue, and currently much more related to the aesthetic results, to be able to frame a crown over implant as we used to have the gingiva framing a natural tooth, right? I need to have fully the papilla there, the emergence profile for this, and that in the majority of the cases just is possible if you can manage good bone and also good soft tissue augmentation. Just bone augmentation is rare for you to frame a case like fully papillas and contour, and I need to incorporate the soft tissue. And for that, then you need to learn a lot, because from the traditional perio, we have as thin graft to work with recession, free gingival graft over here. And for implant site, we need much more tissue sometimes. We need to use a graft of 3, 4, 5, 6, 7 millimeters in thickness to build up vertically. So that came a different need that the traditional perio was not there to help us, and you need to find the way and to adapt the previous technique. And of course, we absorb information everywhere. Every lecture that I go, every lecture that I give, then I see the next guy, different papers, different books, and sometimes you are reading something and then, wow, there is one spot here that maybe help me. And then you incorporate that. So I think when you go for many information, your brain help you to sometimes distillate a new thing. So I absorb things from everywhere. I try to read a lot of different papers, different books, but more papers and more new techniques to really try to understand better what I'm doing.
So one of the things that I've noticed for dentists and doctors in general is that they are scared that they're going to get sued, right?
Okay.
So they are really scared to try something new. So they're like, all I'm going to do is what I was taught. But if all we ever did was what we were taught, then we wouldn't have Ricardo Kern, because you have innovated ways to make everything much more beautiful. And 3-on-6 and all these different things that are constantly being innovated. So there's just like, how do you know, like, where's the line in doing some experimenting that where you're trying to figure out new, better ways of doing things, but at the same time, making sure that you're safe and careful, or like, and feeling, because for me, it's been a difficult road to feel like other doctors are going to trust me in the things that I'm doing, because they're like, well, there's no literature on that you should break it up into bridges. It should be one full arch. I'm like, well, there's literature on Wolf's Law. There's literature on these different things. It's like, this hasn't been, there haven't been studies on the 3-on-6 that have been around for, 10 years. My first case on this was 11 years ago on my cousin, and I haven't really done any literature on it. I'm starting to put some things together where I can better show doctors. But anyway, so the question, like, how do you handle when you're sort of doing experiments on humans?
Okay. First, if you position like experiments, I don't see like that, okay? I'm not going to try something in my patient that I have no clue if that is going to work or not. Okay, let's try and see what is going. So, okay, let's start to organize this thought. First thing, if all the procedures that we do is to try to give for the patient a solution that currently or not so long ago was not possible, right? So the first point of view, if I do nothing, I cannot give for the patient what the patient needs, okay? My point of view, that is not a success case, okay? Right. That is a failure. I can try to improve. And every time that you are trying something new, as I mentioned, is not completely something from the blue.
Yeah.
You are adapting something that you already know that is exist, or that is work, with a slightly small modification here and there for small improvement.
Yeah.
So took me a couple of years for me to get to the level that we're doing. So hundreds of surgery, every surgery try to do the best, every surgery to changing small points, and then you are touching the ground to give further steps, and then you go for a little bit more aggressive surgery, but you have tried something similar before, and then okay, this surgery is nice, you try a little more. Of course, eventually we're going to face the failure, right? You're going to have a case that you're not able to deliver for the patient. But one thing about soft tissue surgery is if you fail and you wait like 60, 90 days, tissue is going to heal again. And then you can have a new strategy to fix the problem that you create, or even to improve the cases. So sometimes I tell the patient, this is a risky surgery because of this or that, and we can try doing this. If you fail, at least I can deliver you the case in the way I get it.
Yeah.
Okay? Or if you fail and you try again, sometimes you can even go to the position. So it's not like an experiment in the patient. It's, I think it's our responsibility as well for this slow evolution, trying to do the best, and of course to collect the good cases. And I think it's responsible trying something that you don't know what to do, and the patient just to see how you're going that, right? I never did that, and I always use the information that they have to try to modify it to improve. It's a continuous and long process to really go there.
Yeah, and just always making sure that the patient is aware of the potential consequences or risks that are associated with the surgery.
Yes, indeed.
So one of the things that it sounds like you're saying, like, a lot of your learning has come from doing discounted procedures for people, and that's where your education came from, doing a lot of surgeries at a lower price until you became more well-known and more popular at that point, and then you were able to raise the prices. I feel like a lot of the new doctors right out of school are expecting to be charging Ricardo Kern prices, and they're expecting, like, I should be making, like, I'm doing the same surgery as him. It's like, you don't understand what he went through to get to where he's at right now, and how many of those surgeries he had to do for free or highly discounted to be able to gain that education. Because so much I think of the schooling is just didactic, and it's not really hands-on. And once you graduate school, that's when you actually start learning how to do it. Because I don't feel like any of the things that I've learned with this, or very little of it, I learned in school. Most of it I all learned after school, and just from doing discounted procedures, and just trying to really get a lot of repetitions.
Once again, it's like an investment, right? And you are helping people. You are helping other human beings that maybe cannot pay for a full price, and you're helping those guys.
Right.
You told about your cousin, and the nice part is not just about come up with a new way to approach. The good part was to listen to you that, okay, the guy get confident again, start to smile, and could deal more with the depression. And it's this kind of things. And that is sometimes the reward. And money eventually is going to be in your hands if you're doing something with love, with a lot of care, and deliver everything you can for that thing. So eventually, the compensation is going to be there. Don't be so concerned about that, because if you're driving our lives for just the money, it will became a slave for the money, and money never is enough. You have a nice car, the guy next to you have a better one. Then you need to go for that. Then you're going to never stop it.
Yeah.
So we need to be sometimes fulfilled with different things. Money is good. Of course, we just cannot be a slave from the money, and I cannot driven all my life to go after that. So I think it's one long way to get there, and I enjoy all the way through.
Right. So a new doctor right out of school, what recommendations do you have for him to try and become where you're at right now?
Okay. I think everything you do, try to do really the best. If you're going to do a composite, try to do the best of them. Try to learn how to layer, how to do the best. You do a perio treatment, go for the information. And the new generation now has so much information very easily to reach. So not just through social media, talking about you can have scientific papers and all the books in the world in a few minutes in front of you. So invest a lot of education and read more. So to try to be the best in every single case. So the learning process is much more intense this way. And just to make a quote here, there is a book published a few years back by Malcolm Gladwell. I really enjoy his book. There is a very interesting point of view in his book. And he has one book that is about the 10,000 hours. Have you heard about that? Yes. So to summarize for the guys, he says that for you to get really good in doing something, you need to practice that 10,000 hours. And he gives different examples, from the Beatles to the guys working some law, the guys that are working in computers, whatever. For them to get or to do what they do now, to be really top ones, they have spending more than 10,000 hours. They came with these numbers. Okay, but let me tell you one thing. If you spend 10,000 hours and you are not trying to do your best in these 10,000 hours, I bet that you're not going to learn much, okay? Our patients, for example, brushing, probably they spend much more than 10,000 hours brushing, right? And they still, a few of them, do a very bad work. Why is that? Because when they are brushing, they are not even care what is going on. Their mind is thinking about something else, but not in brushing. They are not trying to do the best of the brushing, taking care of that. Every single surgery that I go there, either I'm going to really do the best in the surgery. So if you are really there, super intense to do the best, you're going to learn much more from that specific case. So sometimes I have some memories when I was very young, and in an intense moment when I was very little. And that memory is so intense, still for me. I can walk, I can smell, in that specific moment when I was very young, because it was an intense moment. So put this intensity, this presence, this love to do the best in every single surgery, and then you're going to see that things is going to improve. Just don't do things to finish the day. Try the best in every single case. I think it's that can incorporate a lot from what we do.
Yeah, and I can definitely see that in you, that you are amazing, and I can feel the love and all the things that you do for your patients and the pride that you take in your outcomes. And so I highly recommend Dr. Ricardo Kern. If you're a doctor looking at taking courses and getting continuing education, I'm not sure that there's anyone better for the perio in the world than this doctor right here. I highly recommend go. He's got his courses in Brazil, in English, Spanish, and Portuguese. He comes here to the United States every once in a while as well. So if you're a patient in those areas and you have a really complicated periodontal case and you're willing to fly out to Brazil, you probably should, because he's the best, and you will get probably the best outcome you can with Dr. Kern. And anything else you want to say about your courses?
No, usually we organize the courses all around the world, but especially in Brazil, we have that done in our own facilities. So we have an outstanding structure there. I live in Curitiba, south part of Brazil. Outstanding city, very organized, safe, a nice place to go. And it's a 5 days course, very intense. So in 5 days, you can really approach soft tissue management in order that people leave the course being able to apply that, right? So when we do that in short period of time, sometimes people struggle to apply that, but 5 days, very intense, with a lot of theoretical, hands-on, clinical case discussion, and also we do some live surgeries for presenting to the attendees what they had learned, so they can see live what is going on and how to apply that. And the feedback from people that attend the course is really amazing. So I'm really glad to speak about the course, and you're going to be welcome to Curitiba if you go there.
Right. Okay. All right. Well, thank you very much for coming on to the podcast and coming out to Cabo. Sure appreciate your presence here and think that you're an amazing human.
Anytime. Thank you so much, right?
If you're considering restorative dentistry with dental implants, you should know all of your options. Head to 3on6.com and book a free consultation with a 3on6 provider near you. If you enjoyed this content, please like, subscribe, share, or leave a review in the comments. Until next time, keep smiling.